I'm looking for a motion for the agenda approval this afternoon. Ed, move, and do I support? Larry, all in favor? Opposed, if any, that's carried. Thank you. On the agenda presented to you this afternoon, is there any conflict of interest? Okay, I hear none, so we'll certainly have that noted. So we'll move on to 4.0, and which is the update. Dr. Nazaturi, the floor is yours.
Board of Health Chair, Mr. McNamara, members of the Board of Health, colleagues, thank you so much for giving me an opportunity to share the perspective of the Public Health Service. At the onset, I think it's worth recognizing that the Public Health Service is a construction of the legislature, and Ontario has been at the forefront of organizing public health services. It was in 1873 that the first public health statute was passed by the legislature. And in preparing for today's meeting, I also found out that the first Board of Health was actually in southwestern Ontario, in Charlottesville in Norfolk County. So Ontario has a long history of advocating for the public health, and has a long history for actually regulating the practice of medicine. And Ontario regulated the practice of medicine well before many American states. So that's particularly relevant as we're going to talk today and have some dialogue about perhaps the Immunization for School Pupils Act. Before we get to that, I just wanted to share with you, and I know my colleague Ramsey has provided a fulsome report, but briefly, the burden of COVID-19 to the community by many of the commonly used metrics is greater now than it was a few weeks ago. And just looking at the case counts, we're running around 60 per 100,000 people. We are number 6 in case count in case rates in the province. Percent positivity is 3.8%. And these things, 2 items that I think are particularly relevant. We've dismissed more than 450 groups of young people in schools. So the burden of COVID-19 among young people as it relates to case counts is high. And these young people have been disproportionately affected to the extent that they are being excluded from school. I would hazard to say qualitatively, though, we've not had to close that many schools in the context of the number of cohorts. And I think that is in part a testament to the strategy for containment, i.e., or that is that if COVID does somehow penetrate screening and makes it into the school, we're doing our very best collectively to try to keep that limited to as few school cohorts as possible. The other item I want to share is also a qualitative data element. And one of the things we're seeing in recent weeks is that we're having clusters of cases or groups of cases. That's one challenge. But these clusters are being tied to other clusters. So real world example is we see exposures at schools and people being infected at schools, and that being leading to transmission at recreational events or recreational athletic events, and then that being transmitted to social events such as a party. So that's troublesome from a qualitative point of view. The other item is that we're seeing in certain cases, a large number of cases or a significant number of people being recognized to be infected in residences of elderly people. So I think that we just have to keep monitoring the situation, but we are concerned about the burden of disease being increased. One of the effective strategies to reduce the burden of illness is, in fact, to increase vaccination rates. And vaccination rates still have an opportunity for improvement, especially among young people in schools. I know that my colleagues and we had proposed that that the Immunization of School Pupils Act should be should include COVID vaccination as a covered vaccination. And I think it's well worth having that debate on a personal level. And as a public health official, I think that is the right course. And affordance, the Immunization for School Pupils Act creates an affordance and a framework. And with that, I think we're likely to get higher vaccination rates. Why are higher vaccination rates important from a public health point of view? Well, first and foremost, people who are vaccinated are less likely to get sick. They're less likely to get infected. They're less likely to transmit the infection to other people. They're less likely to die. And so on an individual level, getting vaccinated prevents somebody from getting sick and dying. And on a community level, it prevents the transmission of COVID-19 to other people. If vaccination rates get to a higher number and all other things stay about where we are, I think we're more likely to be able to withdraw at least some public health measures. My colleague Ramsey had sent me some data today, but in summary, the people being hospitalized and dying from COVID-19 are substantively or primarily the unvaccinated. And I think he shared with me that if you're unvaccinated, and he'll correct me if I'm wrong, you're 90 times more likely to be hospitalized. That's it's quite a it was striking to me even this far into the pandemic. So I think that we have to consider every reasonable approach to improve vaccination rates. I also want to share that one of our school board colleagues, school board chair, sent a letter to to Mr. Lecce asking for the Immunization of School Pupils Act to be modified so that COVID-19 vaccine can be included. As difficult as COVID is, and as much of a challenge as it is, we have other public health priorities as well. And I'm pleased that we're going to have this dialogue at the Board of Health related to other things, and one of them is improving the oral health of the community. It is a gap. It is a gap in medical services, to the extent that I was just looking at the data today. 1 in every 4 people in Windsor-Essex don't have health insurance, dental health insurance. And if you don't have dental health insurance, there's one barrier to getting care. And many of the people who don't have health insurance, dental health services, or dental health insurance are children. And cavities, for the most part, are preventable. So I know we're going to talk about fluoride later today. And I think the people of Windsor-Essex should be commended for reintroducing fluoride into their community. But I do think from a public health point of view that we really have to think of how we can improve the oral health of the community and particularly the oral health of children. I'm grateful for the opportunity to speak today, but I think that moving forward, we have to consider all the strategies to effectuate COVID containment, but also to focus on those public health activities beyond COVID. And I think if we do both things well together, I think the future is promising. So thank you so much for allowing me to speak today. Thank you.
All right, thank you very much, Dr. Nasaturi. Is there any, before we move on, any questions to our medical officer? Okay, well, I mean, it's self-explanatory, obviously. I was a bit disappointed when I saw the numbers come out this morning with 66, and it's just a gradual upswing. And I know we had a bit of a discussion yesterday at, actually Mayor Snively brought it up at County Council last night, and in terms of the numbers, and our message is, we need to continue to be vigilant and understand that we're not even close to being over the hill. and we're still climbing. We're getting near the summit, but we're not quite there yet. And so we, as things open up and as capacity has changed, it doesn't mean that we leave our guard down. If you don't have to be in a group area, or it's best that you don't. And here in this end of the woods, American Thanksgiving has always been kind of our second Thanksgiving. And now that the borders opened up and there's going to be a lot of cross-border activity coming up. And we just heard from the governor, they're getting back to a crisis situation in Michigan. So we need to continue the educational piece, and so it's again, we've got a ways to go.
Yeah, and Board Chair, Mr. McNamara, if I could share, we just got this data calculation, but the case rate for people that are vaccinated is 95.7 per 100,000. And for the unvaccinated, it's 337 per 100,000. So 3.5 times difference. And if we, at the current time of the 611 ICU beds in the province, 78 of them are occupied by people who have COVID. So about 12% of all the ICU beds in this province are currently being occupied by people affected by COVID. So yes, I share your concern, and I echo your comments that we should not think this is over.
Okay.
There's a couple hands up, Gary.
Okay, yeah, go ahead, Judy.
Hi, thank you. Through the chair, I just had a question. You were talking a bit about transmission, and I hadn't heard a lot of data on this, so I wondered if you could explain a little bit more about the transmission from people who aren't vaccinated, so that it's still a concern for people who are vaccinated, that people who aren't vaccinated are a risk to them and they are more likely to transmit the disease to other people. Is that what the evidence is now showing?
Yeah, I think the general view is that if you're not vaccinated, you clearly are at a higher risk for getting infected. And if you're infected, you're more likely to transmit the disease to other people. In part, we're still learning more and more about COVID, but if you have viral particles and you're sick, and you're particularly very sick, you're going to cough more. And if you cough more, you're going to expel the particles. And also, if you're unvaccinated, you're more likely to be sick for a longer period of time. So the time period that you can expose other people is longer, and the effectiveness by which you can transmit the illness by exhaling respiratory particles is also greater. So, that's at least a theoretical construct that we would use to say, if you are unvaccinated, you're more likely to infect other people.
Right. Okay, thank you.
Okay, anyone else?
Yeah, thanks. Thanks, Chair. Good afternoon, everybody. Thanks for the information, Dr.
I can see your forehead.
There
we go.
Dr. Necessary there. Appreciate that. You mentioned the numbers going up again in our senior population, long-term care homes. Can you expand on that a little bit, please? I know that a lot of them have gotten third shots here lately, and the risk homes and long-term care homes. But are we finding that some of those people are still unvaccinated, and who's getting COVID in those settings, please?
Yeah, so I presented the qualitative item, and my colleague Ramsey can talk about the actual number of outbreaks. But what we're seeing is we do know that people who are vaccinated can still get COVID, although they're less likely to get COVID. And if they do get COVID, they're less likely to be hospitalized and die from COVID. So I think those are two pretty clear items. But we are seeing in certain instances individuals that are vaccinated, a large number of them in an outbreak getting COVID itself. Now, why is that important? Well, we always know that there's a certain number of people who vaccine doesn't work for, perhaps 5 to 10%. We also know that there's at least, we understand that there is likely to be waning immunity, and that's why people have got their third doses. In a vaccinated community, overall, in a vaccinated community where you see a number of cases, what we're worried about is the spread of disease to other people, including unvaccinated or highly vulnerable people, people that are otherwise ill. And that's the concern moving forward. It's just one more signal, and sorry for the long-winded response. It's one more signal that the burden of disease in the community is more than we would like.
Yeah, thanks, Doctor, and I appreciate that. And I guess, that's always a concern, especially with, people getting third shots and whatnot. Can you tell us the vaccination rate, has the percentage gone up in the last 30 days since what we have in our minutes? I know it was, 21,000 in the previous 30 days. Do you or Ramsey have that figure of first or second doses here, and what would our percentage be in Windsor-Essex County?
Yeah, off the top of my head, I think there are 51,000 people who are eligible for the vaccine who have not currently received the vaccine. And a few months ago, I think that number was closer to 65 or 70,000. So small inroads, but inroads nevertheless into the vaccination of the population. I think, and Ramsey will correct me, or maybe I'll just ask Ramsey to tell us the exact number of the percentage of people who are currently vaccinated who are eligible for vaccine. Ramsey, if I could ask them, Mr. Chair, for Ramsey to comment on that.
Ahead.
In terms of our coverage rates, they're quite high. For 12 plus, for one dose, it's at 86%, 86.3%, and for second doses for fully vaccinated, it's closer to 82.7%. So in terms of change over the past 30 days, it is incremental. It has been going up, generally speaking, about 0.1% each day or every 2 days. So we are seeing uptake there, but there's still room for improvement.
Okay, that's good to hear, and I appreciate the update. That's all I have, Chair. Thank you.
Just on that point, Ramsey, before you go up, but that's from age 12 and up.
That's right.
So if you put the population of 5 up to 12 and then that number would actually drop.
That number would actually drop. If you're looking at our entire population with at least one dose, if you were to include children below 12, for at least one dose, it's at 75.8%. Okay. And for the entire population, for fully vaccinated, it's at 72.7%.
So it goes back to Dr. Nazaturi's point early on, is that the importance of getting, those who are in the range of getting vaccinated. That 51,000 is important to get that number as low as possible, so that the generation or that group, that especially the infant side and the most vulnerable and their seniors, to protect them. I think that's a critical point where we got to continue to educate and push that forward. Ed?
Yes, I think my question really probably had been answered in the past, but I'm going to ask anyway. A lot of people have been under the impression that eventually we're going to develop immunity for that disease we have. And whether they have vaccine or not, this is how some of them feel really strongly. I would just like to listen to the doctor and see what he would say about developing immunity naturally without even having any vaccine.
Well, like a lot of these questions, they're not, there's no definitive answer. I would say this, that if you are infected with COVID-19, you'll probably have some protection for some period of time. But that doesn't mean that you shouldn't get the vaccine, because I think the vaccine adds something to your level of protection. So on an individual level, if you've had the disease in the past and you've survived it, that probably provides you some level of protection. As a public health strategy, though, I don't think that's the best public health strategy. What we want to do is to try to get as many people vaccinated as possible, so that we'll have as many people protected as possible, so that we'll have a reduction in burden of disease at the hospital level and in the ICU level, and that'll free up more healthcare resources for other disease states beyond COVID. To me, that's the chain of the chain of events. I think it's a little bit unanswered about, is there an like what is the level of immunity that you have related to being previously exposed, and how long that lasts, and how long that might last for.
Doctor, thank you so much. I wish a lot of the general public is watching this program, the one we are on it now, about developing immunity. Thank you so much.
You're welcome.
Thank you, Ed. Any further questions? I know, Gary, your hand still up, but I think it's just from the previous. Okay, Rob. Robert?
Thank you. Are you able to hear me?
Yep.
Okay. Question for the doctor. I hear a lot of comments from the hesitant populations that, well, if I can get it anyways, even though I'm vaccinated, what's the point? And of course, we always say it prevents you from getting deathly ill. But I think there's also another side to that, is if I'm understanding it properly, the infection itself can be measured as a viral load that is, my understanding, a logarithm. And the long and the short of it being is, the sicker you are, the more contagious you can be. So if you're unvaccinated and sick, your ability to spread the virus is much greater than someone who is vaccinated, still contracted the virus, and are somewhat sick, but they would not have the same contagiousness. Is that correct?
Yeah, I think that's a fair characterization. And if I could just sort of expound on your comment, transmitting the illness means that you have to get infected with it. And then once you get infected, you have to expel the particles onto other people. So the longer that if you're unvaccinated, you're going to be probably sicker for a longer period of time. So you'll have a greater opportunity to make more people sick. Secondly, if you're unvaccinated, you're going to be sicker, meaning you're going to cough more. And if you're going to cough more, you're more likely to expel those particles a further distance. So in sort of a basic, as an elemental framework, being unvaccinated makes you at a higher risk for transmitting the illness to other people.
Thank you.
Judy?
Thank you, Gary. Sorry, just a follow-up question then to the doctor. Also speaking, can we talk a little bit about the data about the long haulers? I mean, we're talking, and again, there's a lot of people who think, well, I'm not in that high risk group, so I likely will not get that sick. But also the burden to themselves and on our community, because we're seeing, I don't know what percentage, but it seems like a growing percentage of people who are experiencing long-term symptoms from COVID.
Right. It's clear that there are some people who have who get COVID and get better. That's most people, but some people have persistent, long-acting symptoms, and there are a constellation of symptoms. Perhaps for the next Board of Health meeting, we can give you the exact data on what those percentages are, to frame it that way. The one thing I would share is that it is true that many of the people who have died of COVID up to this point have been the very old and those people living in residential facilities. But there are people who are living in the community who have died of COVID. And so there are people in their 50s, people just like me, and I'm in my 50s, who have died of COVID. So although there's when we think of the burden of illness for COVID, we have to think that it affects a broad swath of the community. And some people, as you point out, have suffered from the long-term morbidity of the disease as well. And we'll try to get you more exact numbers for the next Board of Health meeting.
Great, thank you.
Okay, any further questions? I think, Ed, your hand is still up. I think it's from the previous question. Okay. We'll move on to approval of the minutes of the regular board meeting of October 21st. Can I have a motion on those minutes? Joe and Gary, on those minutes, any errors or omissions? Okay, hearing none, all in favor? Opposed, if any, that carries. Thank you. Business arising, we have 6.1, the consumption and treatment services update. I think Nicole and Eric, I think, are going to bring that forward.
Yeah, Mr. Chair, I'm wondering if we can address, and rather if the board, through the board, if we could address resolution recommendation reports prior, and then we'll get to the other items. I know there's some board, I'm just worried we might lose board members with the time.
Okay. So you're referring to the
budget, 7 point, if we could deal with 7.2 and then come back to 6.0 and go through the rest of the agenda from there.
Okay, not a problem. 7.2 resolution recommendation report, 7.1-2, Lori.
Okay, so while Lori's going to, you will see the resolution for your consideration in the budget package. Lori's going to go through a fairly brief presentation, as brief as it can be, budget presentation. And this year we took just a little bit of an approach for all of you of the board to sort of lay out a few various scenarios related to the budget, and then have made, a recommendation from our perspective on a scenario, but wanted to ensure that you're aware of sort of the risks, with each step. So
Sure.
I'll turn it over to Lori, and she'll go through all of it.
All right, so I'm just going to quickly share my screen.
Yeah, it's looking at page 12 on your agenda package, 12, 13, and 14.
All right. Okay, everybody. Yes, so as Gary indicated, the budget recommendation report starts on page 12 of our package. The budget for 2022 includes expenditures associated with the mandatory programs as indicated under the Ontario Public Health Standards. And in this presentation, I'll just refer to them collectively as the mandatory programs. It will also touch upon the COVID-19 program, which will include activities not only relating to case and contact management, but to vaccination efforts, as well as any enforcement related activities. The recovery program, we will discuss those types of program associated with those types of activities, and looking at the recovery and return of services within Windsor-Essex County post-COVID, or as COVID becomes less impactful in our community. And then lastly, we'll talk about the Ontario Senior Dental Care program budget as well. So for mandatory programs for 2022, total budgeted expenditures are $20,409,456. Our budget includes an estimate of offset revenue. And offset revenue for board's information is things like parking, reimbursements that we receive for immunization, fees that are charged in regards to inspections of $147,724, bringing our total net budgeted expenditures for 2022 of $20,261,732. The salaries and benefits continue to represent a substantial portion of the mandatory program budget. As you can see, they are 79.5% of the budget as compared to 80.5% in the prior year. Other operating costs are 20.5% as compared to 19.5% in the prior year. Some highlights to note for the 2022 mandatory program budget are that For 2022, the salaries and benefits are based upon 151.98 FTEs as compared to 164.5 in the prior year. This reduction represents really a shifting of headcount or human resource capacity from the mandatory program to other programs such as the COVID program and the recovery program in 2022. Overall, the other operating costs have remained consistent year over year. And really just within the financial captions within the operating costs, we see a shifting of dollars. So for example, under rent, there was $73,000 decline in rent. The Essex office, which was online till roughly July of 2021, is now offline in 2022. Those dollars, however, have been redeployed to purchase services as we are looking to hire a third-party consultant to assist with the Windsor building project in 2022. Now moving to the COVID-19 program budget. As I had indicated earlier, the 2022 budget really is the wholesome case and contact management, vaccination, and enforcement efforts, recognizing that in 2021, we had proposed a budget that very much segregated our COVID response and vaccination efforts as per the direction of the ministry. This budget here supports 62.04 FTEs across multiple roles within our organization. This budget, as you can see, is a decline of $3.2 million as compared to last year. There are certain highlights that I'd like to note. So last year's budget, looking at both the response and vaccination side, we had 93 FTEs in our budget. This year, we only have, again, the 62.04. Secondly, from an operating budget perspective, there is a substantial decline in operating costs of $1.2 million. Our budget last year contemplated third-party services being acquired to support case and contact management, which approximated $600,000. Those costs are not continuing in 2022, and as such have not been budgeted for. Additionally, the 2021 budget had contemplated expenditures associated with personal protective equipment, medical supplies, and information technology. The Ministry of Health during 2021 supported public health units and others alike with supplies on a new cost basis. Therefore, the 2022 budget does not account for those items. The recovery program includes activities to support. Sorry, I think somebody's not muted. Try again. The recovery program budget for 2022 includes activities to support recovery efforts in Windsor-Essex County. These include planning for a community needs assessment and a review of surveillance data to identify priorities in our community, informing program restart or program development, as well as strategic planning for the next 5 years. The recovery program budget supports 22.73 FTEs across multiple roles. Operating costs are, again, primarily focused to supporting our community needs assessment and our strategic planning. The Ontario Seniors Dental Program budget. This budget is funded at a rate of 100% by the Ministry of Health and Long-Term Care. For 2022, we see this program supporting 16.5 FTEs, representing a 5% increase from fiscal 2021. The budget for 2022 will see an increase in expenditures in the amount of $706,678 to address the increasing demand for these services in Windsor and Essex County. As Nicole suggested, indicated, we established 3 different scenarios that we want to walk through in regards to how programs and services will be funded. So the 3 scenarios are really tailored mostly for the mandatory program, the COVID response budget, and for the recovery budget, the Ontario Seniors Dental Care budget is not included in this scenario analysis as it's funded by 100% by the ministry. So in the first scenario that I have on screen, it sees the funding from the Ministry of Health for 2022 increasing by 2%. So likewise, when there's an increase in funding from the Ministry of Health on the mandatory program, there is an increase as well on the side of the obligating municipalities. So they must go together on this. Secondly, this scenario assumes that the 70-30 funding split will be maintained in 2022. And then lastly, the scenario assumes that 100% funding will be available for things such as the COVID response program, as well as the recovery program, in excess of what the mandatory funding approval is. So for scenario one, we would see the obligated municipalities seeing an increase in their contributions from 2021 of $136,985, bringing their contributions to $6,986,242. So for the board's information, I've kind of walked the funding as compared to the expenditures through, just to articulate how we would see our annual service plan basically being laid out and submitted to the ministry. So the $23,287,474 of total mandatory funding for 2022 represents a 2% increase from the 2021 budget, which is $22.8 million. The next three lines represent the expenditures from those respective budgets: 20.2 for mandatory program, 6.3 roughly for the COVID program, and then 2.3 for the recovery program, bringing total expenditures to $28,881,369. Again, for purposes of calculating what our one-time request would be, we would take the total dollars of expenditures, the 28.8 as compared to the 23.2, and we would have an excess of expenditures over total mandatory funding of $5,593,895. That would be the figure that we would put forward as a one-time funding request. The next slide shows two other funding scenarios. And again, as Nicole had indicated, what we wanted to articulate was the full range of financial risk to both the WECHU and the obligated municipalities should circumstances differ from the current year. For instance, if the ministry were to say, if you look at your budget in totality, regardless of whether it is mandatory program or not, you would be required to pay 30% of the entirety of the bill, or in another scenario where in the event that the ministry would only fund the 70% of the mandatory program, and then anything in excess of that 70% would be funded by the municipalities. So scenario two listed on the page is the requirement for the obligated municipalities to fund 30% of the totality of the budget. So I'm going to just very quickly flip back here. Potentially the Ministry of Health would fund only 7% of the mandatory program. The contributions to the obligated municipalities would an additional $5,593,895, representing 100% of that excess. So what we would have otherwise requested as one-time funding would be 100% borne by the municipalities. This would then bring the obligated municipalities' contributions for the 22 year to $12,580,137. So our scenario that we have enclosed in our report is based on our recommendation is based on scenario 1 that's enclosed in our report. It is similar to how we were funded in 2021, and as such, that is why we've put it forward. However, again, it is important that the board understands the potential risks to the obligated municipalities in the event that the Ministry of Health does make decisions otherwise in terms of how they will be funding us in 2022. So I have the motion as it's presented in the report on screen for yourselves. However, Gary, if you would like, if there are any questions that the board has for me, I'm happy to entertain them now.
All right, thank you very much, Laurie. And I believe Reno got your hand up.
Yes, thank you. And thanks, Laurie, for a very comprehensive review of that. Have discussions not happened with the ministry to understand where they're going with this? It's a little bit frustrating because I think even municipally, we've gotten money for golf courses, we've gotten money for other things. And when we're literally talking about COVID related expenses from a Ministry of Health supported agency, we don't have clarity of what our funding will be. So as we're about to enter our municipal budget session, do we not know? I mean, obviously, and Laurie just mentioned it, but do we have any sense where the Ministry of Health is going with this? As far as, I'm assuming because you're recommending option 1, that you're confident that it will come, but even the fact that it's a risk seems absurd to me. So, where are we at with those conversations, and what's happening around those conversations?
So Nicole, did you want to go first?
Yeah, so Laurie and I will probably say the same thing, but she can certainly supplement. So we were recommending option 1 because we feel fairly confident of where the direction of the ministry is, but our budget approvals usually don't come till far into the year. It is also an election year, so you never can tell. We have been given indication that the ministry will continue to fund COVID related expenses into 2022. We haven't been given a assured guarantee, but we have been given indication that they will fund COVID related expenses into 2022, including recovery expenses. We included an increase because we also believe that there is an indication that they will potentially see an increase across the mandatory budget and programs. But we feel it's important to walk our board through, if we don't receive that funding, what are all the potential impacts? If mid-year we don't receive what we want and we have to go back to municipalities and say, that there was a change, at least we've kind of walked through those scenarios. Laura, do you want to add anything?
No, that's effectively it.
Yeah.
Okay, well, no, I appreciate that. So thank you. That's it for my questions, but I'll be prepared to move option 1 at the appropriate time.
Thank you, Reno. Yeah, and I think it's a conservative approach, but at risk. But I firmly believe too that on the COVID side and those expenses, we're all 30 plus health units are in the same position, and I think it'll be more of a weaning of those expenses than an absolute we're drop dead done in 22. So I think it's as it was discussed even at the executive that that scenario, although there's some risk, it's something that I think is justifiable, moving forward. Okay. Any further questions?
Councillor Sleeman has his hand up.
Okay, go ahead, Councillor Sleeman. You're muted.
Can you hear me?
Yep.
Okay, great. Thank you. Like often in municipality, when when there is a funding coming from the government, they always try to break it down, which one is or how much is due to COVID-19. And I know when we have, I mean, when you send the invoice to us, of course, we will be paying our share, but does it really show what part of it is due to COVID? And if there is any government funding coming to us, sometimes municipalities recover that funding because of COVID. So when the invoice is going to the city and the county, does it show it's not just your share, but also how much is it due to COVID-19? That question actually go to either to Lori or to Nicole.
So when we communicate the contributions for the 2022 year, it's the contributions in totality that are given to them. So they get the dollar amount that they pay for the entire year and then per month. We also append the budget document with them so they can clearly see what proportion we have estimated that will be associated with COVID versus recovery versus mandatory programs. So we do articulate that. And then on a settlement perspective, that'll come out of the financial statements. The municipalities would be able to see that.
Lori, the reason I asked the question, I know the municipality, I know at least in Windsor, they keep a track how much is it due to COVID, and whether they recover part of the money, all of it, or none of it, I don't know. But this is what's happening, and I was just wondering if they will be aware of it in terms of, say, okay, could be $1 million due to COVID, or could be less or more. That kind of my question.
They would be aware of it because, again, the budget document will be appended, and the budget document is very much broken down to show what we estimate the COVID costs would be for the year. And then effectively, it's their pro rata share would come out of that. They'll be able to calculate that.
That's great. Thank you so much.
Thank you, Ed. Any further questions or comments? Okay, so I'll go back to you, Reno. You're prepared to move recommendation on scenario 1?
Yeah, so moved.
And supported by Ed. Any further questions or comments? Hearing none, all in favor? Opposed, if any? That's carried. Oh, so Robert? Questions? Yeah, could you?
No, I'm sorry. I rose my hand to support the motion.
Yeah.
I couldn't get it down fast enough. Sorry.
Yeah, it's a bit difficult when you're sharing the screen and the little squares are pretty small. The little yellow hand, sometimes I can see it, and but just kind of give a shout out. Usually it's always that's always better, but for me to be able to follow. One of these days we'll be inside the boardroom. We'll be able to see each other. Okay. Was there a question, though, Robert, you wanted to bring forward?
No, it was a thorough explanation presentation.
Okay. Okay. Thank you. So that resolution is now in the books. It's passed. Okay. The next one, too, is a resolution. We might as well do 7.13 as well.
Yeah.
At this stage here. The COVID-19 vaccine and the Immunization of School Pupils Act. That's the ISPA. And so I believe Christy and Nicole, or Nicole
Yep.
and Christy, or
Nicole, Christy, and Dr. Necessary. So I'll start off.
all three.
I think Dr. Necessary set the stage for this. So before the board, we have a recommendation resolution report for your consideration. This would be to ask the ministry to include COVID-19 vaccination as one of the vaccines in the Immunization of School Pupils Act. Kirsty can certainly add, as well as Dr. Necessary, but we believe this would be a very important step. Certainly, we would have liked to have gone into the school year this year, with this in place. There's a lot of effort that we have gone through and a lot of resources that have been diverted certainly to slowly inch our vaccination rates up. And what ISPA does is it creates a sort of system for that, both a system for education as well as for providing proof of vaccination. So, we think it's the right step, and would like certainly the board's support for this motion. And I don't know, Christy or Dr. Nasseri, if you want to add to that. Dr. Nasseri, you're on mute.
Christy, do you want to go first, and I'm happy to supplement that, or would you like me to just comment?
You go right ahead.
So, typically in the public health service, we're always cautious about requiring people to do things. And for the most part, we try to take the most facilitative approach. But in this particular case, we're in the middle of a pandemic, and we have to balance, from my perspective, issues related to autonomy versus the fact that young people collectively have suffered, and our overall community has suffered because of COVID and the pandemic. Secondly, the historical context is that, from my estimation, the Immunization for School Pupils Act is a very progressive piece of legislation, because it set the framework for either having people get their young people vaccinated, or alternatively to provide a framework to demonstrate why their children should not be vaccinated, be that a religious exception or otherwise. Thirdly, I think that if we look at the evidence, the diseases that are covered by the Immunization for School Pupils Act have approximately a 90%, and my colleague Ramsey can give the exact number, but it's over 90% coverage for those covered vaccines, and we're far from that with the COVID-19 vaccination at the current time. So if we want to get our community healthier, and we also want to keep schools open, I think this is an appropriate balance, at least for this year, to require to include the COVID vaccine in the Immunization for School Pupils Act. So thank you for allowing me to share that perspective.
Okay, thank you. Christy?
No, the only piece I would add is, the foundations around the ISPA and sort of the systemic level of organization we have related to the ISPA. By adding COVID-19 would create a bit more structure as well for us to just have an understanding of, vaccination and who's vaccinated. Also help with a bit of the educational pieces as well for individuals who are looking for exemptions. As an example, there's a process under the ISPA. So I would just add that this is sort of an already built system. So adding this as a component of the ISPA really builds on, a lot of that foundation that's already there.
Okay, well, thank you for that. Questions, Reno?
No question. I would just enthusiastically make that motion.
Okay. Do I support Robert?
Thank you.
Any further questions or comments? Hearing none, all in favor? Opposed, if any? That motion carries unanimous.
Thank you.
Okay, so we've dealt with those two resolutions. Can we go back then to the consumption treatment services update, Nicole and Eric?
Yeah, so we'll keep this brief. Eric's just going to provide a few slides. So we were hoping, we have given updates to the board. If you'll recall at our October meeting, you had approved us to move forward with a single location after the public consultation, which was 628 Goyu. The next steps were approval with the approval of the location with the city of Windsor. We were hoping to go, have already gone this week to the City of Windsor and have been asked to join in December instead. So Eric, are you able to share your screen?
Yes. Can you see my presentation here?
Yes.
Okay, let me go into that format. Okay, thanks, Nicole. So I've discussed with the board a couple of times in addition to the October resolution, but I have a bit of an update here. So let me just skip through here. The burden of opioids in our community has been growing at a high rate over the last 5 years. You can see here there's 358 opioid-related emergency department visits were reported in our region in 2020, which is 98 more than those reported in 2019 and more than triple that reported 5 years ago. There were 68 reported deaths in 2020, which represents the highest number of opioid deaths in our region since reporting began in 2005. I want to get into how the process started. So the feasibility and acceptance study in 2018 and 2019 were a series of community consultations resulting in, I guess, the learnings that 61% of the respondents indicated that an SIS, which at the time was the name for a consumption and treatment services site, would be helpful to Windsor-Essex County, and a majority of survey respondents who indicated that they injected drugs said that they would consider using an SIS if it were available. And you can see that 71% said yes, and an additional 7% said maybe. Many of those respondents thought that the area of downtown core would be well served for a location for one of these sites, and that obviously maps very closely onto where we're seeing overdoses occur in our community. Based on these findings in September of 2019, just reiterating a little bit from what Nicole had stated, the Board of Health resolved in support of a submission to Health Canada and the Ontario Ministry of Health for the creation of an SIS in Windsor. So following this endorsement, one of the first things that we did was establish a stakeholder advisory committee, and that committee consisted of members from obviously the Windsor-Essex County Health Unit as the chair, but also City of Windsor Social Services, Housing, Windsor Police Services, Windsor-Essex Community Health Centre, Hotel Dieu Grace Healthcare, and Positive Pathways Community Service, or the former AIDS Committee of Windsor. The role of this group is ongoing, but initially it was to establish additional criteria outside of those which were required in the federal and provincial applications for locating a site, determining a short list for those locations, providing contextual information from each of their organization's perspectives to inform the consultation process and proposed operations, and that is on an ongoing basis. And then, as mentioned, providing the ongoing guidance to the operations. And this is something that was established initially in order to inform the consultation, but now is intended to move through towards operational considerations and then kind of the sustained operations of the facility in our community. So the site selection process, I mentioned the CTS Stakeholder Advisory Committee. We also partnered to establish the requirements for an eligible site that were complementary to the mandatory criteria in the two applications that were meant to submit. We worked with Windsor Police Service to conduct crime prevention through environmental design audits on both of the candidate locations that we were considering in the site selection, and identified that both would lend themselves sufficiently to establishing manageable safe consumption zones, which is how Windsor Police Services is referring to the area. We then acquired tentative signed CTS terms agreements with both sites and their corresponding property owners, under which it allows us to conduct the consultation without losing access to the site ultimately. So the purpose of the site-specific consultation was to gather community feedback about the two potential locations that we were looking at, to inform the selection of one optimal location, and to ultimately seek endorsement from City Council before submitting the two applications. So the components of that consultation were a community survey that yielded 448 survey responses, so a sample size that we were very happy with. 13 key informant interviews with businesses and agency stakeholders operating within a defined radius from the proposed sites, and 7 focus groups with area stakeholder groups, and 3 virtual town hall meetings that presented a panel of experts for the community to ask questions of, and promotion of that took place with basically pounding the pavement and door-to-door knocking in the residential neighborhoods surrounding the site, of which there were very few. So based on the findings of the consultation, we did land on a proposed site that was approved by resolution of the board in October. That was 628 Goyo Street. The board essentially provided the endorsement to move forward to City Council for further endorsement of that site. The site itself, 628 Goyo Street, you'll see it is on the right side of the building in the picture. We do have access to the upper and lower units. It has, when combining the upper and lower units, almost 3,000 square feet. It does have an outdoor space, which was a criteria that we were looking at, 2 entry points, and it would be a lease agreement. The site itself, this is just an overview, and I will click through and you will see the map or the arrow here indicating that is the left side of that business. You can see across the street, I'm not sure if you can see my mouse or not, but the McDonald's is on the corner of Goyo and Wyandotte, and then the Windsor-Detroit Tunnel entrance and our other candidate site was what's indicated with that Cashmax icon there. This is an artist rendition that we had our graphic design team put together. Again, you can see the existing state on the left and the proposed state on the right here. The rendition, you'll see that it reflects a day and a night mode. And the reason that we did that was to show the lighting and security considerations that would be made in the evening hours. You can see security cameras set up there. You can see kind of a revitalized frontage of the building, a mural on the side, which is proposed. And you can see parking for bikes and vehicles. At the back end of the building, you can see again the current state, which is on the left, and the proposed state on the right, which would allow for clients of the consumption treatment services site to spend some time post-consumption to chill out in an outdoor setting and to be observed as needed. So next steps is the endorsement from City Council. Nicole alluded to the fact that it was meant to be this past Monday that we were going to City Council. We've been moved to the December 20th meeting. We are speaking with partners about delegations at that council meeting and procuring letters of support at this stage of the game. The proposal to the city, if passed and endorsed by City Council, would then allow us to go and move forward, complete our applications for the federal exemption and then the provincial funding application. I have here a little bit more about proposed plans for operations and the roles of some key partner agencies, recognizing again that there's a number of agencies that we're continuing to engage with on this process, including Police Services, City of Windsor Social Services, Hotel de Grace Healthcare, and other potential partnering agencies that may ultimately have an influence on the operations of the site as well. So us as the lead applicant, funding recipient, transfer, we would secure the lease and I guess liaise back and forth with the ministry and federal governments on the operations. Then the operational lead, who would be responsible for obviously the operations, staffing, and other considerations, would be the Windsor-Essex Community Health Center, and then Positive Pathways Community Services would be leading a needle syringe program satellite site out of the proposed site. So that would allow for clients to access harm reduction equipment on site. So that's the extent of my presentation. Happy to answer any questions at all from the board, and thank you.
All right, thank you very much, Eric, for your presentation. Any questions or comments to Eric? Yes, Gary.
Thanks very much, Chair. Eric, good to see you again, and I know we got an ongoing email here, and it was good that we didn't waste too much time. We could talk about it today. So the current building is occupied as some type of a used furniture business. Is that once we secure the building, they close within 60 or 90 days, renovations, and then a potential opening 6, 9, 12 months, something like that?
Yeah, that's not far from what is realistic. We've, the extent to which the site would need to be retrofit in order to serve the purposes would dictate a lot of the actual opening date. The other thing is consideration for the timelines on Ministry and Health Canada approval, which is something that we don't have control over. So pending approval from City Council, we would look to move really quickly on submitting those applications, and then we would, continue to engage with what's been a really cooperative and I guess proactive property owner to determine, the terms agreement, extending that terms agreement, or moving into a leasing agreement and potential operations.
That sounds good, and those are good timelines. Eric, talk to me a little bit about the people that come through these consumption sites, safe consumption sites, the ones that are really looking though for help. Is there percentages that we can get from other safe injection sites, consumption sites, that give us some broad numbers as to the 100 people that come through, how many just want to come through, chill out, and go out the back door, and how many are really looking for some help to get into a program to be rehabilitated?
Yeah, I mean, we do have access to some data from other operating sites and things like annual reports. So that those could be provided for other operating sites. But what I will say is, in terms of ongoing monitoring of the proposed site, is that those types of metrics are required to be reported to the funding agencies, or to the provincial Ministry of Health. So those are metrics that we are required to track and move forward, in addition to a number of other things, such as, discarded needles, overall traffic through the site. So that's something that we'll pay very close attention to. The other thing that I want to mention is, regardless of where people are at in their recovery process, it allows us to engage with those folks and have a conversation about whether they're ready, and then they would know where to go if they were ready to look for help. So yes, there will be people that come through the site and not be seeking any sort of referral, but over time it would be the role of the staff at the site to have conversations with those folks and try to lead them in that direction.
Yeah, and that's great to hear. And you're right. They're not, some people aren't going to want it on day one, but they might, on day 8, 10, 22 or whatever, they might want to look for those type of services. So,
right.
So Eric, my last question, and this is one that has happened in other consumption sites, where at the end of the visit, that they'll provide unused needles to the users and let them go off on their way. Is that something that's being proposed with this consumpmption site?
Well, that's a service that's offered currently in our community in a number of different areas. So through partnership with the AIDS Committee of the former AIDS Committee of Windsor, Positive Pathways Community Services, unused needles and harm reduction equipment are provided to people seeking those. But Nicole, did you have something you want?
Well, I was just going to add that that's a mandate of the health unit. So we receive funding directly for the needle syringe program, and we have a service level agreement with AIDS Committee. They also provide that service, but just wanted to make sure that the board's aware that the needle syringe program is a program that we are required to provide, and we already receive funding for that, and we partner with AIDS Committee, to deliver that service. And certainly, whenever you have a consumption and treatment services site, it is about harm reduction, and so certainly that would be a site that you would expand and provide that service there as well.
Okay, we'll leave it at that for now, and then maybe we'll have a little broader discussion at City Council on that when it comes through, Nicole and Eric. But thanks for the update. Thanks, Chair.
All right, thanks, Garrett. Any other questions or comments directed to Eric? All right, hearing none, then if I could have a motion to receive Eric's report. Reno and Gary, all in favor? Opposed, if any, that is carried. Thank you. All right, that's done there. Okay, we've got information reports, the COVID-19 surveillance and epidemiology, Nicole, and then Ramsey, and then we'll follow that up with the if there's anything that in the communications recap that Eric you want to address to follow 7.11.
No, nothing on my end. Thanks.
Okay. The COVID-19 surveillance, well, I think we've, Dr. Nezateri hit some of the highlights, and I believe with Judy's inquiries as well, is that come back, I think, with a little bit more information at our next board meeting. So a motion to receive those information items. Reno and Larry, all in favor? Opposed, if any, that's carried. New business, I think you were just going to touch base. Nicole, just give us a bit of an update on fluoridation.
Yeah, so actually, if the board remembers, we did receive correspondence previously. There has been continued delays in the implementation of fluoride into, we did receive an update from NWIN a few, maybe 6 months ago or so, that indicated that the reintroduction date had been moved and likely it would be November of 2021. So we are here in November of 2021, and you'll have received, we just received reports that had gone to the board of NWIN, as well. Dr. Nestori and I both had a chance to meet with representatives at NWIN this week, and they had provided an update that due to the pandemic, there were some continued delays, and in particular around procuring certain items. And so the reintroduction is not happening this November and will be delayed. They're hoping early in 2022 now. That we'll see the reintroduction of fluoride into Windsor, LaSalle, and Tecumseh water. Certainly, I'll just add that obviously we're anxiously awaiting this. Just to note for the board, we normally do track our screening data within the schools, which is an important indicator of oral health in our community. And due to the pandemic, we haven't collected that information, but we have seen a significant increase, certainly, in the number of youth and seniors that we see within our a dental service within our dental clinic, and our waits continue to be quite lengthy. So anyway, something that we'll continue to monitor.
Well, I'm glad you brought that up, because that was my question, my follow-up to you, to say, in particular with the, we know that when the decision was made to reintroduce, we saw quite an uptick, especially in children and in core areas in the community. And so that would have been my question to you is where do we stand today? So obviously you're seeing some of it, but I'd still be curious to see, even in the younger, our younger residents within the community as well. Is that what if the trend is continuing to go up?
So our oral health report that we brought forward prior to the implementation was a 5-year period. I think we had data up until the end of 2017. So we do have surveillance data for 18, so we will look at 17, 18, 18, 19, and then we don't have complete surveillance data, screening data for 19, 20, and none for 2021. But I can tell you anecdotally, and then certainly in our surveillance, it hasn't improved, but it is something that we'll look to bring to the board. And we had hoped to do something this year, but we'll bring what we have available forward to the board, this coming year in 2022.
I'm wondering, Nicole, if we had, obviously, I think the data is somewhere there, but even a conversation with our local Windsor-Essex Dental Association, if they would have, obviously they would see the rise, but the other big concern is that and again, Dr. Nezateri brought it up, that 1 out of 4 has no coverage whatsoever, and so the dental care itself, how many are going without and not using the service, that's provided through public health.
Yeah, and those were indicators that we did hope to survey our community actually this past year, and due to COVID, we haven't completed that. We will go out and survey again. We do know anecdotally, again, that due to the pandemic and some of the pressures on the dental community, we're seeing more referrals for HSO clients. And then for seniors, certainly we are the only service provider for seniors, so we'll continue to see that increase. I would say that the complexity and the number of youth, again, anecdotally through our own service that need and require urgent care or emergency services, continues to grow as well. So those are all certainly indicators of, access and poor oral health.
Okay, if there's any further questions on this particular issue, then motion to receive the information from NWIN, and so that we can have that incorporated into the minutes. Moved by Reno and supported by Judy. All in favor? Opposed, if any? That is carried. Thank you. Okay, move on. Correspondence. We've got 4 items here. If I could have a motion. Okay, a motion to receive those. Judy?
There's 9.1 we would recommend to support.
I will. You're
sorry.
ahead of yourself. Receive those 4 items. Judy moves the receipt and supported by Reno. All in favor? Opposed, if any? That's carried. If there's items that you want to bring forward, and I would surmise it's 9.1, that we support the urine purge, public health, letter to the Honorable Christine Elliott. That's a recommendation for mandatory staff vaccination for staff working in the home and community care sector. Well, no brainer. Moved by Reno and supported by Gary. All in favor? Opposed, if any? That's carried. Okay, so that in open session, that pretty much covers everything. We're up to item 10, and if I could have a motion to move in committee of the whole. Judy and Ed. All in favor? Opposed, if any? And that's under section 239 of the Municipal Act. So